The most challenging part is how do we know it's intra-arterial sclerosis when we're facing a clot. So basically when a patient comes in with an M1 occlusion, with cerebral artery occlusion, how do we know this is based on atherosclerosis? There are certain hints in the patient history, also in the angiogram, but we cannot definitely prove. What we know in summary is that mechanical thrombectomy as a first-line treatment is very successful and it has a very high recanalization rate. But even if treated with mechanical thrombectomy, some will fail, some will not completely recanalize, and they have very poor outcome. So, and this could be due to atherosclerosis, and there is a certain fraction, about 5 to 20% in the European population, maybe higher in the Asian population. But it could also be to the residual clot. So we basically unable to take the clot out, the embolus out. So the treatment strategies that are published currently are diverse. Important to understand is if you're facing ICAD in the setting of stroke, we are facing two enemies. One is the clotting, the local clotting because of the ruptured plaque, and the other one is the stenosis and the elastic recoil, and both have to be treated to some extent to have a patent vessel in the long run. Different treatment strategies have been proposed. I think there's a common agreement that it requires debulking first. So we're going to take care of the clot by normal means, aspiration or stent retriever. We're probably facing the stenosis then, and then the question is how to continue. Different studies have shown different approaches. There are freestyle studies which use intra-arterial thrombolytics plus PTA plus stenting or one of each, showing a signal that it does work. My personal idea is all these trials are doomed to fail, pragmatic approaches. There has been a PTA trial from China that has been published at the World Stroke Conference this year, but it was not able to show superiority of PTA versus best medical treatment. So PTA, and this is in accordance to the cardiology literature, might not be the way to treat. Stenting is, and it seems as if with all the downsides of intracranial stenting, this might be the way to go. I'm aware of two trials coming up, one from France and one from Switzerland. So if it comes to how to treat acute treatment of symptomatic intracranial stenosis, ICAD in stroke, I'm pretty confident that the Asian studies will show us the way to go.